go now to Mr. Van Bynen. Mr. Van Bynen, go ahead, please. 5 minutes.
Thank you, Mr. Chair, and thanks to all the witnesses for joining us today. This is quite a panel, and I appreciate you taking time off of your schedules to answer some questions today. I'd like to start with my questions with Dr. Tam. We continuously said that as we learn more about this virus, our approach evolves. And as we vaccinate more and more people from different priority groups and locations, I think it's fair to say that our knowledge about these vaccines evolves too. Now, I've heard of a few cases abroad where the antibodies were found in babies whose mothers received the vaccination while they were pregnant. I think this is certainly something to give us some hope. And I'm wondering if either nationally, internationally, you have seen any of these cases, and are there any studies about these situations? And if so, can you tell us about them?
Mr. Chair and honorable member, thank you for the question. And as you indicated, we're studying the science as we go along. And I think based on other vaccines, it wouldn't be surprising that some antibodies could, for example, be passed on from the mother to the baby, either through the womb or indeed through breast milk. So these are being studied. Yes, I have heard of some of these accounts, but that evidence is being reviewed. And we actually have research studies on vaccination for women who are during pregnancy as well, persons who are pregnant. And we will look forward to some of that data. It is also important to emphasize that women or persons who are pregnant have an increased risk of COVID-19. So, and the advice at this point in time is to offer persons who are pregnant the vaccine because of this increased risk. And it may provide some benefit to the baby, but that remains, I think, to be studied.
Thank you. Still on the topic of priority groups, our approach across Canada was to identify specific groups and target them for early vaccination. Could you please share with the committee how impactful this decision might have been?
Mr. Chair, that decision has been very impactful because COVID-19, of course, has a disproportionate impact on certain populations, including our most senior age groups, as well as those in congregate living settings, such as long-term care. And then, of course, those at high risk of exposure to the virus, such as healthcare workers. I'll just point out that in this third resurgence, the number of deaths, and every death is really, we should take note of, but the numbers are much smaller during this third wave, whereas we would have expected that to be much higher as the protection of the very effective vaccines. Long-term care facility cases and outbreaks have dramatically decreased. And that was the first thing that we noticed about the vaccine program. And then the rates in the over 80 years and over plummeted really at a very fast rate. So that was another really good sign. And vaccine effectiveness studies being carried out in Quebec and British Columbia indicate the effectiveness of that, even the first dose of vaccine. Healthcare worker cases have also dropped as a result of them being vaccinated as a priority group. So I do think that those prioritization has had an impact. First Nations communities, they were prioritized, and the territories, and have had a really high vaccine uptake. And I do think that the vaccine has played a very key role in protecting those populations.
Thank you. Now, throughout this entire study, and even through our previous study, we've heard from numerous witnesses about the importance of sharing health data across Canada. And while we've mostly heard about this in the context of COVID-19, I think it's applicable to other health-related contexts. Do you see a benefit in such a system? And if so, would it impact the efforts to prevent and to manage diseases across the country? Dr. Tam.
Mr. Chair, that is a very important question. And I think public health policy should be driven by data. And we have had data presented, and it has to come from the local level up to the national level. So I do think we've seen data improve over time. This is the first pandemic where we're having case-by-case data reported nationally. through the Pan-Canadian Health Data Strategy, we've now and the Safe Restart agreements and the actual resources being provided to the provinces and territories, we have seen improvements in the data being gathered, including on race, indigeneity, and occupation. So that has improved, and that kind of improvement must be taken forward as we look to keep going in strengthening that data system.